Hey everybody, it's Monique. It's March 19th, 2015. I've been out of the hospital for actually 19 days and I'm doing great. I still have myasthenia symptoms that I take Mestinon 1 to 2 tablets as needed, but actually haven't had any in like almost a week. It's been 6 days, so that's really good. I'm still taking the prednisone, but I'm actually tapering down now, so I'm on every other day, so I'm excited about that. I can't wait until I can eventually come off of it, which is what my doctor and I are working on because of the side effects. It causes a lot of weight gain. Has my blood sugars running a little higher than normal, so I have to check that now. It causes increase in my blood pressure. Also, it has my heart racing. It makes me real sensitive to heat a little bit more than I usually am. So that's pretty much where I'm at right now. And I saw my doctor on March the 4th, and he is considering now doing a thymectomy. That is a surgical procedure where the thymus gland that sits in the middle of your chest is removed. For some reason, there's been research that shows that people that have generalized myasthenia gravis typically respond well. Some people go into remission. Some people just need a very little dosage of medication every day once they have a thymectomy. And some people don't respond at all. So he says he's willing to proceed with surgery when I'm stable, because I'm young, and he says I should fare very well. So I haven't decided on what I'm going to do about that. I'm just praying, and I'll cross that bridge when it comes. Hopefully I don't need to go that route. But I just want to let y'all know how I was doing and to give you a little background on how I got to this point. Actually, I started getting ill. I started having weakness, just periods of weakness where I couldn't move for like hours. I would just lay and I just couldn't even pick up a glass to get a cup of water, and I didn't know what was wrong, but it wasn't as severe as it is now. That went on started in 2004, and it went on for 8 years before I was diagnosed. 2012, I actually got diagnosed with myasthenia gravis, and the diagnosis was kind of like inconclusive in a sense that I didn't test positive for the acetylcholine antibodies, the typical antibody response. I tested positive for striational antibodies, but they said that was not specific. But since I responded well to the medication, my doctor decided to continue treating me as a myasthenia gravis patient. Last year, 2014, I finally saw a neuromuscular specialist in Texas that confirmed the diagnosis by doing another acetylcholine test, which I then tested positive for, and also a single fiber muscle test, single fiber EMG muscle test, and I tested positive on that. So I finally got my diagnosis, and I've been seeing him ever since, every few months, and I've had success. Actually, I was doing pretty good. I had my last myasthenia gravis crisis of last year in May, and after that I didn't have one again until this January. I started feeling so well, I decided that I was going to go back to work, and I hadn't worked in 3 years. As you can see, my voice is starting to get a little hoarse. That's one of the symptoms of myasthenia. The vocal cords as a muscle, and after repeated use it gets real weak, and I have difficulty talking. So to make a long story short, I started working January 27th, and within 2 weeks I was in the emergency room, went into a myasthenia crisis, was hospitalized from February 10th to February 28th. Needless to say, I don't have that job anymore. So this has been a long journey for me. It took me 8 years to get diagnosed. I lost 4 jobs because of this illness, and I didn't even know what I had when I lost the jobs. I just kept getting weak, and I'm a registered nurse, so I had a lot of physical labor that my body just could not tolerate. Now I know, so I've decided to take a different route, and I'm starting back school in the summer for a nurse practitioner. So I decided to do this video because I've been suffering for so long, and I'm really trying to be patient with me because my voice is really going out, so let me hurry this up. I've never given up my faith through all of this. I've never given up on God. I've never given up on myself. And I asked God, I said, I know you're able, God. You can heal me today. You can heal me tomorrow. You're all seeing, you're all powerful. You're able to do this, but there must be some reason that you've allowed me to go through this for so long. So as I laid in the hospital this last time, I asked God, I said, show me what it is you want me to do. And he said that he wanted me to sacrifice one of the most important things that I have, which is my privacy, because I'm not online. I don't have an online presence. I don't do social media, and privacy is one big deal to me. And he wanted me to give a testimony for his glory, to let people know that life is tough, but you can't give up. We're all going through things. We're all going through things, but if God can bring you to it, he can bring you through it. And that's what I found. I've lost a lot, but I've also learned a lot through this process. It's made me trust God in situations that I couldn't understand, situations that at times I was very afraid, but he gave me this courage and the strength to get up and move forward. With this condition, I have generalized myasthenia. Not only does it affect my vocal cords, and it affects my breathing. I have trouble breathing because of the diaphragm muscle. Also, it affects my arms and legs whenever I have a crisis. I can't barely take a couple of steps without my legs giving out. I can't really, truly, this last crisis, I wasn't supposed to be eating, but my mom came to the emergency room and she tried to give me a piece of sandwich, and I couldn't even open my mouth up wide enough to bite down on this sandwich. It also affects swallowing. I have difficulty swallowing. My muscles in my face don't work properly, so I have a flat affect, meaning it's hard for me to make facial expressions, and sometimes I might look sad, but it's difficult for me to smile, and you can hear my speech is starting to slow down because I've had a long day. And I wanted you to see how it is. Like in the morning, most of the times, if I had a good previous day, I'm fine, but as the day wears on, I get more and more weak. So I wanted you to see the progression in my muscles, because on a good day, people see me and say, oh, there's nothing wrong with her. But 1 minute I can be fine, and if I overwork my muscles, the next minute I'm not fine. So I have to really listen to my body and just take rest breaks when my body says stop. I have to stop. The last thing I wanted to say, again, that just to encourage, and I want you not to give up on God, and don't give up on yourself. Don't give up on life. If you're here, just keep it moving. Thank God every day that you wake up. He is here for you. And the scripture that I always go to that has helped me through this is Isaiah 40:31. They that wait on the Lord shall renew their strength. They shall mount up like they shall mount up on wings of eagles. They shall run and not be weary. They shall walk and not faint. And I just want everybody to know that you can make it. And this disease is not a life sentence for me. It is a temporary situation, regardless of what the doctors say. It is a temporary. Your situation is temporary. You will get through it. Some situations are short temporary, some are long. But you will get through it, and remember to live on purpose. Thank you. Bye.